Welcome everyone to Latinos in Clinical Research, our December webinar. Today we are here with Will Krugman, who is going to be talking about patient recruitment advocacy and kind of give us a little bit about his background, what he does in that area. And we're here also as well with Ashley and Chris, I believe a few of our other co-founders. I don't believe anybody else has joined, but hopefully they'll trickle in the next couple of minutes. Thank you for being here with us today.
Yes, thank you so
And
much. And Will, thank you also for being here. I wanted to say that your background is quite amazing and I'm really excited to hear more about it. So if you want to, introduce yourself and we'll kind of roll through there.
Yeah, thank you so much for having me. I've been following Latinos in clinical research on LinkedIn and other socials for a while, and I'm happy to get an opportunity to talk with you all. So I started working in clinical research during the pandemic. Prior to that, I worked in marketing and communications agencies for most of my career, working in both healthcare and non-healthcare related industries. I've done public relations for Walmart and Amazon. I've done consumer marketing for various companies, and I've worked in student recruitment for the Department of Labor. A few other experiences that I think were really informative in shaping the way that I approach clinical trials are some community engagement projects that I worked on early in my career. I worked for the Metro Nashville Public Planning Department, and our goal was to create a 25-year planning plan for the city. Our role in that was to talk to everybody in Nashville about what they wanted to see in their city and how we can build an equitable, prosperous city moving forward. And so I learned a ton about how to talk to people about important issues and how to build alliances, reaching out to faith-based groups and advocacy groups, all of these critical audiences and perspectives that we needed to hear from that I think really apply to any kind of community engagement campaign, and especially with clinical research. As you all well know, it takes everyone to make sure that a clinical trial works and reaches enrollment and has a representative group of patients involved. So that was really important for me early in my career. And as I mentioned, started working at Clinical Research Associates in 2020. I had just finished business school and there was a pandemic and I was looking for a job. So all of the stars sort of aligned at the right time. And I've known the owner of CRA almost my entire life. And she thought that I might be able to help with some patient recruitment using the PR and community engagement skills that I gained over my career, plus a little bit of the analytics and the business side that I learned at Vanderbilt when I was in business school, which I think really combined nicely to form kind of I don't know if it's a unique approach to patient recruitment and engagement, but it's definitely successful. And it's something that I'd love to talk more about, how we approach it and how we think about it. And some of the experiences that I bring from the consumer world, I think really should be applied in some cases to clinical trial patient recruitment, just in terms of kind of being the servant to your customer. And customer in this case, I don't really mean the sponsor companies that are technically our clients, but really the patients, because those are the people that are making the hard decisions to enroll in the study. And I believe that it's our responsibility to do everything we can to make it easy for them to enroll and accessible for them. So that's just a little bit about me. I'm happy to go into more and looking forward to this conversation.
Thank you for your work. That's awesome. Such a great background. I know that this is kind of an area that I think is gaining even much more attention as of recent, just because of the diversity and the push for that. It should have always been there, right? But nonetheless,
Absolutely.
yeah. So I mean, I'm sure Judy has quite a lot of questions because she's the site owner. She's a huge advocate on this end at her site. But one of the things that I'm curious about is, with all your background experience and now being in research, what are some of the components that are similar and that you've been able to transition into research that have really helped you with your role?
That's an interesting question. So a lot of the skills that I developed are marketing, advertising, and public relations, and those tie in really well to patient recruitment. For example, I know how to run Facebook ad campaign a lot better than a lot of other folks in the industry. I know how to do a public relations campaign, which has been incredibly helpful. Reaching out to members of the media, developing relationships in that way, I think is really important. And understanding how to use your budget in the most effective way, because I know everybody has really tiny marketing budgets that are sponsor provided, and getting the best use out of those, I think, is really important. Things like audience building and audience targeting, writing to your audience are incredibly important. Knowing who they are, and understanding what their problems are and how you as a business can solve them, or at least offer them something, and things like that. Really just understanding how to craft a message and to make sure that the right people hear it at the right time and give them an opportunity to act.
Oh, sorry, Judy, you were gonna say something?
Yeah.
Go ahead.
No, actually, I was going to ask you. I know you mentioned the last part. Is there a specific communities that you're focused in, that you work with, certain centers, certain therapeutic areas? Have you tried
Oh, sure.
everything pretty much in every condition?
Yeah. So my business has been around for more than 30 years, and we've done every, in clinical trials in almost every indication you can think of, except for HIV and cancer. Just for background, we are an independent trial site. Um, we have one location in Nashville, and we've been doing this for, well, since 1990. So, 33, 34 years. Um, right now, we're focusing on a lot of vaccines, as we have been since 2020. RSV, COVID, flu, every kind of combination that you can think of with those. Um, and we're getting on the bandwagon for the weight loss drugs that are becoming more popular, semaglutide, Ozempic, Wegovy, those sorts of things. And we've done, stop smoking, heartburn, acid reflux, diabetes, really almost everything that you can think of over the, last 3 decades. But since I've been there, it's mostly been vaccine work. And to your question about communities, we're focused in Nashville. So really anybody that has an interest in the public health of Nashvillians, I think, is somebody that can be an ally for us. We've worked a lot with Meharry Medical College. I see Dr. Caldwell is on the call. Dr. Caldwell is an investigator at CRA as well as a professor at Meharry Medical College. And for those that don't know, Meharry is the oldest HBCU medical school in the Southeast. So since the pandemic, we've been working together to raise awareness about clinical trials in their student body, who are the future leaders of medicine in America, as well as their providers. They're closely tied to the Nashville General Hospital. So we see a lot of referrals from that sort of relationship. And Nashville just has a very big, diverse community. We have a large Hispanic population as well. We're closely aligned with an organization called the Hispanic Family Foundation, which we've done lots of events with in the past. And in 2020, we had a town hall with our medical director and the public health director, who also happened to be Michael Caldwell at the time. So it's everybody, I think, needs to have a place. And we're a small business at the end of the day, so our hands are a little bit tied, and sometimes we're so busy, we want to do the best job that we can. So really every kind of organization that we want to work with is located in Nashville, but it's just, how many hours are there in a day? How can we possibly reach everybody?
Oh, yeah, for
Yeah.
sure. Oh, go ahead, Judy, sorry.
Sorry, I wanted to ask, and what have you found has been the most successful approaches? And I'm sure it's more than one, because I know that in our community that's what it is, but
Yeah.
is it more community outreach, physician, combination both with advertising? What have you noticed? Or does it depend on the condition as
So
well?
I think it really has to be a combination of everything. And I know that might kind of sound like a cop out, but it's true, because as an independent trial site, we don't have physicians that work directly for us. We only see patients for clinical trials. So developing the relationships with our local healthcare community is incredibly important to help build trust. And at the same time, you have to back that up with, in my opinion, paid advertising and really aggressive. Well, aggressive might not be the right word, but really really powerful marketing campaigns to capture that interest and not let people forget about it. Because, you know, you can get a referral from a physician, or you can hear about CRA through a friend who had a good experience. And then we need to do the best job that we can in targeting those folks with the appropriate advertising on Instagram or Facebook or Google or wherever they may be, so that they have a chance to to really consider it. It's one thing to raise awareness. You know, we talk about a marketing funnel, and at the very top, you need to raise as much awareness about your cause or your product or your service as you can, and then follow that up with an opportunity to sign up for a study, and to make sure that you continue to reach people, because somebody's not going to do that on the first time they hear about it. They might, but that's rare. It's important to continue to message and be in touch with folks all along that path.
I actually have a question too. So I think, so you guys you're in Nashville, right?
Yeah.
And so I'm from Texas, and
No.
I know that depending, on the region, sometimes there's obviously a need for diversity everywhere, but in some
Hmm.
regions it's not as difficult with certain diverse populations as others. So I'm curious in Nashville, more specifically with Latinos, obviously with LICR, how
Hmm.
would you say is the engagement with the Latino population and research and actually getting
Yeah.
interaction, because this is, I think, you know, um, I feel like, well, at least what we're hearing is just, there's on the diverse end, it's really growing on many populations, but in Latinos, it's still, kind of trickling in slowly. And so I'm just curious how that works for you guys in Nashville.
Sure. So I have a lot of thoughts on that. First, I think that the response that we've gotten from the Hispanic community in Nashville has been very positive and very open. And I think that people, no matter what their background are, have more or less an equal interest in clinical studies. There might be different things that we need to talk about with different audiences, to ease fears, or to build on the mistrust that has been developed over a long period in this country. And not to brush any of that under the rug, I think it's incredibly important to build trust, because let's be honest, I mean, people have been hurt by clinical trials in this country in the past, and those are real experiences that have happened to people that are still alive and with us today. But that being said, I think especially since 2020, there is a lot of interest in understanding why it's important to participate in a clinical trial, and I think that there's a more openness to be involved. I mentioned the Hispanic Family Foundation earlier, that has been a great partner with us, um, and their leaders are incredibly interested in what we're doing and have been so welcoming, having us on their radio show and their annual breakfast to uh, talk about clinical research and present it to somebody that may not have heard about it before.
For sure.
And I wanted to say, so there's sort of in the industry, I think there's a number that's going around that says basically 5% of all people are interested in clinical trials. You might have heard that number somewhere before. I've certainly read about it a lot. And as a marketer, what I think when I hear 5% of people are interested in clinical studies, I'm thinking that, oh my God, that is so many people in this country, who could be a clinical trial patient if they knew about an opportunity near them, if they knew a physician that was doing a clinical study, and if they thought they might have an opportunity to participate. So I really see it as my job to be kind of the person with the bullhorn saying, listen, we have clinical trials. We want you to be a part of it. And I will work with anybody that is aligned on that. Um, and it's not just the community engagement. It's also, knowing where people receive their news. It's about knowing where people interact when they're online, and being able to reach those outlets in a way that is accessible to everyone.
Yeah. And that's great. I mean, I think that's really awesome as far as like how the engagement. So I'm a curious person in regards to, so one of the things that I've noticed being, both at site, CRO and sponsor, there tends to be kind of like
Hmm.
silos, right? Where some departments are
Sure.
here, some departments are there. And so I'm curious as far as like, CRA, is the the communication like whole, not just with, you guys at the sites, but like internally, is there a
Yeah,
huge push on, translation? Obviously, because I think on the diverse side, aside from maybe one or two groups, for the most part, everything will really run on making sure we have accurate translations and resources given to patients, right? And so,
absolutely.
I used to be on, the you could say the assistant end at the site level. And I know that me personally, when I was at the site, I never really spoke with anybody on the marketing end. And even so
Hmm.
at a CRO level, and definitely now at a sponsor, like it's not really often. So I'm just curious, if that collaboration, if in your previous experiences, if it's there, and if that's something that, should always be kind of worked on and all of those good things.
Yeah, we're a tight group, and I rely on the healthcare providers at my company um, to really power up our communications, because some of the most effective things that we can do are tell the stories of real people and show why they decided to enroll in a study. So I rely on our nurses and our doctors to tell me about people that have really interesting stories.
Hmm.
Um, there was a when we were doing a pediatric COVID-19 study, there was a football player at a local high school that was enrolled in our study, and he really wanted to encourage his peers to be in it as well. So, our nurse told me about this guy. He said he's so amazing, he's so charismatic, and we'd love to, share that with you. So that's, just really important to, I think, for the marketing and communication side, to really know their nursing staff and their medical staff, because they're really going to be either your greatest advocates or your worst enemy, and you don't want
Yeah.
you don't want the latter. You really want to show them the value that you can provide as a storyteller,
Hmm.
to enhance and make their job easier, because my job really is to give them work.
Hmm.
I'm looking to help patients enroll in these studies, as quickly and efficiently and safely as possible. And if I'm doing that, that means that the nurse doesn't have to take time out of their day to call patients, or learn how to run a Facebook ad, or something along those lines. I will say, I sometimes we the for example, a news broadcaster will want to talk to one of our nurses or our medical director, and being healthcare people, they're not necessarily super excited about being on the news, or talking to folks, but they're willing to work with it, because I think that we're able to have an open line of communication and talk about why this is important. And hopefully I've been winning some allies. I don't know if I always am, but I think that it's just important to stay on base there. We work in the office full time. I wasn't super excited about that when I first started, but really, being present in the office, I think, is has really helped
Hmm.
build the relationships between sort of the business side and the nursing staff as well. And I'll also say we have a really fantastic recruitment team that kind of closes all of the loops. Um, my role is more in finding the people to encourage them to sign up, and then we have recruiters that will call them and do the pre-screening over the phone, so that there's kind of a division of labor there that really
Hmm.
streamlines the whole process for us.
That's great to hear that you guys have a process. I do think like prior to being in research, I was in the clinical industry for, I would say, 11 to 13 years. And
Mm-hmm.
I know that sometimes, as far as, how processes are, sometimes it's like, it's done one way and it kind of stays that way. And I feel like when it
Yeah.
comes, at least when it comes to the Latino population, I know that on the medical end, right? It's very hard, especially the older generation, to get them to really, speak out and or speak to individuals about, new or different options that aren't coming necessarily from their well-known family physician,
Mm-hmm.
and so I have always felt that, outside of just, community engagement, that another thing that I don't hear as often being talked about is, actively finding these, Latino medical organizations, also within the region, but even,
Sure.
nationally, right?
Sure.
And actively trying to communicate with them and potentially finding a pathway through there, right? It's I do feel and hear after all these interviews that we've done, you know,
Yeah.
it's always trying to find those new extra ways, right? To get not just to find patients, but also to gain
Hmm.
trust and all of that in the community.
Absolutely. And that's why I'm so excited about our partnership with Meharry. We're working with them to train all of their doctors in clinical trials before they graduate, so that when they do grow up, you know what I mean, graduate out from med school, they have that experience and they know firsthand what it's like to run a clinical trial. So either, you know, they can do it themselves, or they know somebody that can run a clinical trial. Uh, Doing some research over the summer, I found I think a study from Tufts that said, I'm paraphrasing, but basically, um, 98% of doctors say that they would recommend a patient to a clinical trial if they, you know, knew of one. But when it came to actually doing it, doctors recommended less than one patient on average per year across the country. And kind of going further into that paper, there was a lot about how, you know, doctors recommend people to other doctors that they know. And
Hmm.
if you don't really know somebody that runs a clinical study, or you don't run them yourself, then how are you going to recommend that? So, you know, we have an open call to any medical professional in the state, really. Come take a tour of Clinical Research Associates, get to know us, you know, learn about clinical trials, and we'll talk about, you know, any concerns you might have. You know, it's really, like you said, about building those bridges and giving people an opportunity to learn about what's really happening in clinical trial.
Yeah. Go ahead, Tori.
Yeah, I wanted to add that's really important what you said, because I think what you mentioned is something like I'm doing in my community. I think a lot of other people, other sites in their community, sometimes
Hmm.
it's a little easier to do, but it's been a lot more challenging for a lot of us. My
Right.
community, most physicians have never worked in research. They don't have research centers. There's very few research centers in my community. So we've been proactively trying to work more with them, whether if they join as an investigator
Yeah.
or maybe just get educated about research, refer patients. They don't have time to be an investigator or something in between. Could we be more present in their office, share this information? It's really hard for them to do it because they're so busy running the clinic, right?
Yeah,
How can we
exactly.
be an extension of their office in a sense? But that's a lot of work because it requires a team. You know, you have a
Right.
team, I have a little team as well. And not every research center can do it, but I think it's extremely important to get more
Exactly.
physicians, more clinics involved in research in any capacity, because then if they do know about these trials, they are more willing to talk to their patients about it. And their patients might be more willing to participate. They might be more open to it. And that's a lot of, I think, if we could do more of that, it would change the way we would recruit for clinical trials. It's just a lot of work,
Yeah.
a
Yeah,
lot of time.
1000%. And how do you know really how often to, you know, reach out to a physician if they say, yeah, of course, I'd love to. I don't know if this happens to you a lot, but it happens with us where we'll have a meeting with a medical director or a physician at a practice nearby, and they'll say, yeah, of course, like we'd love to learn more about clinical trials. Give us your information, and we can even go and, you know, give a presentation to their whole staff. And then, you know, a couple of weeks go by, a couple of months go by, and we notice, hey, we haven't really heard from them. We haven't gotten any patients referred there. So what's the deal? And, you know, you reach back out and they say, oh, sorry, you know, we're just really busy. And that's just the way it goes a lot of the times. So, yeah, I mean, I definitely feel your pain. And that's why I think it's important to kind of complement that physician outreach and that really kind of deep community building and trust building with um, targeted Facebook, Instagram, TikTok ads, or Google ads that can really kind of close that gap. Because maybe the doctor did mention it to their patient, and the patient just didn't decide to come,
Yeah.
or to call you guys. So, you know, um, if you can then hit them in the next couple of days with an ad that's relevant to them, that speaks to a problem that they have, whether it be, you know, I forgot to get my flu shot, or you know, I have acid reflux and nothing works for me. I have a migraine, and nothing works for me. If you can hit that person with an ad within the next couple of days, you know, after their doctor's visit, then that is, you know, I think that's going to be successful.
Yeah. I actually was curious. given how, large you guys are, do you find it easy, or even if, excuse me, even if the scenario were to come up where you need actual like media, have you guys had
Mhm.
scenarios where you're actually able to bring in media from like community, like news outlets and things like that? Because I do feel just in general, in
Yeah.
every state, that we could use more of that aspect. I mean, but people tend to find that, or organizations tend to find that that's a hard barrier sometimes to come across, right? Because it's
Yeah,
like,
and it's intimidating.
mm-hmm,
You see the nightly news every night, and I I think PR especially kind of has a negative connotation with it. You don't need PR and something bad happened, but it can also be a great platform to tell stories.
mm-hmm,
We were on the front page of our local daily newspaper, Tennessean, 3 times during the pandemic when we started the COVID-19 clinical trials, and um, cannot remember the second one, but the third one, we had given the first vaccine in the state of Tennessee at our trial site. And it was a moment of hope. It was a moment of, kind of a conclusion to this, horrible pandemic that we had all been living through. And we were able to tell the story of, the physician that had the placebo and eventually, got the vaccine. And that's such a powerful tool because people hear about a clinical trial in the most positive possible way. This doctor is saving people's lives, not just in the exam room, but, by participating in a study. And if he can do it, maybe I can do it. And, that kind of thing hopefully only happens once in a lifetime, but there are other ways you can tell stories as well. And honestly, I could do an hour long webinar
session
just
on
about
that.
media relations. Um, just so we can talk about ways you can approach and build relationships with your local media. I mean, it's similar to the way that you would want to do it with physicians. Um, but the media can be such a powerful and helpful tool for you. If you know a reporter, or if you know a news producer and you have a new, we're doing the studies for some weight loss medicine that's been in the news quite a bit recently. And wouldn't it be great if we could say, hey, so and so news reporter from local Channel 4, um, would you like to learn about how this medicine is being tested to make sure that it's safe and effective for everyone? Um, and you might get turned down, but you might not.
Yeah.
And yeah, so they'll come out to your clinic and say, hey, so what's going on here? Can I get a firsthand look at what a clinical trial really is? And think about that. I mean, when you think about the cost of running an ad on TV, which can be tens of thousands of dollars, you can get that same audience. You can reach that same audience for virtually no cost. There's of course, staffing and fixed
Hmm.
costs and the time that you take out of your day to do it, but that is it's just one of the most powerful and potent ways to tell your story. Your local news, I guarantee you, wants to know what's going on at a clinical trial site. They're people with jobs just like you and me, and they want to do something interesting. They want to do something unique. Um, and if you can offer them this, it's especially since the pandemic, something that people have a lot of interest in. And if you can frame it in a way that makes it seem like their audience would be interested in it, which I guarantee you can. And if you need help, feel free to reach out to me, and I'd love to help you write a press release or a pitch to a reporter, because they really can be such good partners.
For sure. Thanks, Will. We actually have a hand raised from Michael Caldwell.
Oh,
Hi, thank you for raising your hand.
Hey, can
Hi.
you hear me? Can you hear me okay?
Yes. Yes.
Well,
Hello.
first of all, thank you so much for hosting this webinar tonight. And I couldn't be more pleased than to see your uh, great guest tonight, Will Krugman from Clinical Research Associates of Nashville. I have to say that my experience, having been the public health director in Nashville during COVID, trying to bring trials in when I first met Will, to now being at Meharry Medical College and also working with Will Krugman at Clinical Research Associates, also as an investigator. I have been so impressed with their outreach, but particularly to the Hispanic community. And in particular, we have a very vibrant and growing Hispanic community here in Nashville, and headed by the Hispanic Family Foundation. And I'd like Will to talk a little more about that, but let me just draw your attention to maybe in your notes, you could put the Clinical Research Associates website, the little video they have to talk about how people could get interested in clinical trials is one of the people that are highlighted is somebody of Hispanic origin who literally was a translator at one of our events talking about the COVID vaccine, who got so inspired to learn and felt like they needed to like contribute. And I feel it's such a testament to just being trying to reach out to the community, identify the community, and trying to let people know there's a need. We need you, and please help us so that we can help others in the community. So, Will, I wonder if you could just speak for a few minutes about how that relationship developed and that video, and make sure that you add that to your notes. So, thank you.
Sure. Thanks, Michael. Appreciate it.
Sure. So your question, I think, was about how we started working with HFF and Jackie. Well, flashback to 2020, we're working on these COVID-19 vaccines. I'm kind of getting a trial by fire in what a clinical trial really even is. Really my first couple of weeks on the job, but we found there were so many groups and organizations that wanted to learn what was going on. Can you just please tell me what's going to happen with this vaccine? Are we going to get it this year? Because I hear that vaccines normally take 10 years to develop. So, could you imagine? But one of the oh wait, sorry. Michael, I think you invited us to go to a drive-through that HFF was organizing to provide materials like diapers, clothes, formula for new mothers that this group normally has inside, but had been converted into a drive-through. But during this event, we got to hand out materials to talk about, the clinical trials that were really just beginning at that point in time. I think this was maybe September or August 2020. And we got to know Monica and Diane, who are sort of the leaders of that organization, and just got to talking, and it kind of came up that they would like to learn more about clinical trials. So Dr. Caldwell and I worked with them and with our medical director, Dr. Stephen Sharp, to have a sort of a town hall style event at their location called Plaza Mariachi, which is sort of a converted mall that is also a community center. So that was live, and it was broadcast on their socials, and with a local media partner called Nashville Noticias, which is a Spanish language kind of digital newspaper. I think they're print as well. But that's sort of how that started, and that was a long time ago. I hadn't thought about how that began in a long time, but that was really a good start to a helpful relationship.
Awesome.
And I can share a link to.
Oh, yes, please share if you can share a link. I'd love to know more about this organization. Yeah, we're always trying to. Hey, Perla, we're always trying to, get associated and linked. LACR, especially towards the end of the year, we tend to get a little bit more busy because we're internally, though, because of all the things that we're
Sure.
working on to bring on for the new year. And one of the things is definitely trying to be more involved with the community and try to find more efficient ways to be able to bring that to our community, our memberships. And Perla, you definitely have a community background as well. And so it's great to have you here. But yeah, so really appreciative for you guys having the time today and for sharing that with us. There's a lot of need. I personally, honestly, have not came across many organizations in Nashville that are, pushing towards and for the Latino community. I'm sure there's quite a few, but you guys are the first one. So really happy to have you. And
thank you.
Yeah, of course. And everything it is that you're doing. There is an organization, Judy, do you remember the name? It's with Dr. Rios, National Health Hispanic
Oh,
Foundation.
Yes, National Hispanic Medical Foundation, something similar.
Yes.
Don't quote me on that. I think it's like foreign names.
Yes.
That I think they're focused on doing stuff for physicians in the Hispanic community who are, going to school or already physicians, but also
Oh
something that
yeah.
they added, I think the past couple years is doing more in clinical research about education
Hmm.
and providing more information to those physicians or those in training.
Yes.
So
And
that's another great work.
they're trying to
Absolutely.
connect doctors within their
Mhm.
regions too. So if that's something you guys are actively doing and offering to doctors, I definitely suggest you guys reach out to that organization. They respond
Sure.
very,
Yeah. If you
very
have a
well.
connection or can make an introduction, that would
Yeah.
go a lot, a lot further than, cold email.
For sure, yeah. Well, it's Yvonne. I keep forgetting Yvonne's last name, but it's Yvonne. I'll definitely do a connection. I'll, tag
Sure.
you on LinkedIn for sure. So you guys can, I mean, that's one of the great things, right, of being able to do this in the community. We know people, people, being able to, get us
Yeah.
all connected as quick as possible and bring it back to the
Hmm.
patients, right? Because that's where it matters. There's also an organization, Judy, uh, what is it? The Engagement Conference.
Hmm.
Do you remember? We're on that. It's with Monair or Monique.
Is it the
Um,
is it the SEAL
Monair
group,
from,
Community
Monair, there you
Engagement
go. Yes,
Alliance?
Freda,
no,
thank you.
it's a Site Bridge.
Yes.
Oh,
They're in here in North Carolina where I live.
Yes. So, and there's going to be, from my understanding, there's going to be a lot of community engagement
Yeah.
organizations. And I mean, again, it's in North Carolina. However,
cool.
we don't know how far these organizations reach, right? And so
Hmm.
if that's something that, would be of helpful to you guys as well, I mean, anything we can do to really get as much as we can to different regions of the US for our Latino
Yeah.
patients.
We're part of a group called Tennessee SEAL, CEAL, the
Mhm.
Community Engagement
Yeah.
Alliance. Again, it was
Mhm.
originally formed to fight against COVID-19,
Mhm.
organized by the Meharry Medical College, the Tennessee State Department of Health, and several other nonprofits and healthcare organizations throughout the state that have been, really helpful in vaccinating Tennesseans and providing that option. That's sort of evolved over the last, I would say, 6 to 10 months to really talk more about clinical trials and to do a lot of clinical trial education in communities, not necessarily just recruitment and enrollment, but also, hey, what is a clinical trial? Why do we need to care about them? And how are they impacting me? Um, but I think that these organizations are in every state. I'm not entirely sure. I'm really only involved in the Tennessee version, but I'm happy to ask, and maybe if there's a
Yeah.
connection to be made for any of you all, I'll be happy to.
Yes,
We have one in
please.
here in North Carolina also.
Great.
Awesome.
Yeah. Mhm.
Good to know, Perla. Thank you.
Yeah.
Um, yeah, so I mean that's definitely make that connection, get all that moving and going. And I mean also, it's very close down the road, so probably not, but we're also having Save Our Sites conference. There's going to be a
Yeah.
big focus on the patient recruitment portion and more in-depth discussions that normally, don't get touched on in certain areas. So, obviously we invite you guys to come as well as you too,
Thank
Perla.
you.
We'd love to have you there. I mean, I personally would love to meet you guys in person. But yeah, definitely, everybody that's engaged in the community, everybody that is actively trying to show face and do something that is bringing of change, regardless of how big or how small in whatever part of the region of the US. We invite to, meet, to speak, to communicate, and again, to also help connect you as much as we possibly can. And I mean, I mean, Perla, you're amazing. You've done so much for the community. I'm always watching your posts and a huge advocate of you.
Same. Yeah.
Uh,
Thank you.
I'm
Thank
honored that
you.
yes.
you're at my session.
Yeah.
Look, I'm gonna turn my camera on, but look, I didn't do
Yeah.
my hair or nothing because I
Oh,
didn't
you're
think I was
good.
gonna
You're
be on
good. Do
camera.
not
yes, you're
worry.
fine.
I had it on my I'm in Eastern Standard Time, and I had my calendar at 7:30. I've been sitting in my computer all day. I could have joined at 7, but
No
um,
worries. There's technical. We had
yeah,
this issue
no,
before. We think it's the post up that's happening. I mean, we don't know what's going on. It's tech stuff. So apologies for that.
no problem. But yeah, this is something I'm very passionate about, and it's not just a job for me, right? It's more than that. So
Thank you.
Understand.
Yes. I
Yeah.
know I'm supposed to be on the committee. There's just so much happening. I told Moni that I would just, there's not enough time in the day, right? Like we'll
But we
head
haven't had a meeting yet, so
Yeah,
I'm
we
like,
haven't.
okay.
It's been a little
Oh,
while.
okay. No
I
recent
know.
meetings. Okay,
Because
great. That makes
I
us feel
think
better.
it's gonna happen later next year. I
Yeah.
understand, I believe.
Yes.
So the
It's
date's
not
still up in
happening,
there.
yeah. Because
Okay.
it
Well,
was gonna happen this year in
Right, right.
October or November, but
Mhm.
then they decided to push it out a year, but we still haven't even started planning that. So
Right.
well,
I
there you
don't
go.
know.
Well, if you
It's in
guys are,
February, right?
well, it was supposed to be
No,
in February. SOS is in February.
yeah,
It's in
Oh,
February
okay. I
in
thought that's what you were talking
Tucson.
about.
Yes, yes. But I mean, there's going to be a lot of huge, a lot of big names going to this event. So there's a lot of support, on all ends, regulatory, site ownership, all of those kinds of things, and even new nuanced site owners. So again, if this is something that is of interest to you guys, not just on the recruiting end, but I mean, I highly
Yeah,
suggest you guys should show. But thank you so
sure.
much for being here today. Again, thank you so much for your
yeah.
flexibility. That issue that we had
Thank
the
you.
other time around. It was just really
Thank you so
great.
much for having me.
Yeah, of course. And we're gonna definitely make
Yeah.
sure to that post and have that tag like Michael had requested. And we'll make sure that Dan adds that in because he's our behind the texting guy. But we
Yeah.
definitely need to come back and roll around next year and just see where you guys are at, and maybe there's points of doing this again or some form of collaboration that we can do. Anything again
Yeah,
to
I'd really love
promoting.
to do this again. And if it's okay with you, I'm kind of working on a workshop for digital advertising for site owners and marketers, recruiters. I think it'd be really helpful just so people are armed with that information when they're building outreach campaigns. I think it might help kind of get you over the line of that recruitment goal.
Yeah, I mean,
Be
anything,
great.
yeah, that's amazing. So thank you for doing that because I
Or and
don't,
also media relations and PR. I think just knowing how to develop a relationship with your local press. Sorry, my camera's so
Mhm.
shaky.
oh no, you're fine.
Um, but like I said, I'm just a huge advocate for that. So would love to share that with everyone.
Yes,
Yeah,
please send us a
Yeah.
email, and I
Yeah.
mean you were on the email with Judy today, so do that. We'll also share that. We'll make an announcement on our membership because obviously, if we could help sites and or community leaders to help better advance
Hmm.
themselves with that with patients. I mean, yes, for sure.
Hmm. Yeah, I've noticed that not a lot of sites have necessarily a dedicated marketing or
Mm-mm.
communications person. It's often a business
Mm,
owner or a doctor or a nurse who's kind of being shoehorned into this role, which is,
mm,
I mean, this is a full-time job,
exactly.
and it arguably two full-time jobs. So if you just need to be able to be kind of dangerous in that area, so that you, when at least if you're talking to a vendor or a sponsor, you can have some points to bring up and maybe even increase your budget somehow.
Yeah.
That could be a huge
I mean,
benefit.
gosh, if we would have, well, at least if Monica, because I don't know when you all met, but if we would have known that, of you and the specialty, I mean, we would have definitely offered the opportunity to come as a speaker on our social media
yeah,
portion for
Sure.
SOS, Save Our Sites, because again, what the full mission is to give back, right? Always give and
Hmm.
give what provides more. And so just the fact that you're offering this to people, to organizations and sites, that's really huge. And that's what we really love with people and organizations that do that. So because it's not very often that we come around just giving, right? With no
Right.
background intention or anything like that. So we're grateful for this, and obviously, if we're able to attend, I'm happy to. And if it's I mean, super informative, I would definitely bring that back to our team. So maybe consider you guys for the following conference because I know sites would be
Sure.
have a
Yeah,
lot of
I'm sure
use.
this is going to be the first of many Save Our Sites conferences, and looking forward to seeing how it goes and the planning for next year. And Perla, you mentioned this earlier, but you said it's sort of not just a job for you; it's really kind of
Mhm.
what your purpose is. And I've been in the
Yeah.
industry not near, not for a very
You're a
long
lot
time.
younger than me.
I don't know about that. I was just going to say that, it's just something that I think is like now is the time to really grow the clinical trial industry and make it what it should
Mhm.
have been for this entire, the entire time.
Yeah.
Um, and somehow all of my interests have combined into this job. that I did not even know about 5 years
Wow.
ago. So it's really cool, and really looking forward to what happens next. And hopefully, my background can be a benefit to somebody else.
I'm sure, definitely. Everybody, regardless of what background, even if people don't have a background, there's plenty of help to go around for people to
Yeah.
make a difference. And that's again why we do this platform. Our issue is manpower, right? There's just so much that's going on that we
Same.
can only
Yeah.
do so much. But sometimes that can definitely be, something like a side end that makes you feel like, man, we should be doing more. But at least if we can do this platform, if we can do this podcast monthly, get people out there, get people connected, and
Sure.
hopefully it helps somebody. We're happy to do that in the meantime. So we're very happy that you were able to come here today, Will. So happy to get to speak with you, Michael. Appreciate it. We are so excited to be able to provide this to our members. We will be emailing this out as well as posting it on social media platforms, including LinkedIn, and it'll also be on YouTube. So we're excited, and we hope you guys get people hit you up on the back end
Yeah. Thanks,
for
Ashley.
this. Yeah, of course. Thank you guys so
Um,
much. We really appreciate everybody's attendance. And then again, Will, thank you.
Yeah, thank
yeah.
you.
Thanks
Will.
again, Judy and Ashley. It's great to see you guys, and hopefully see you soon. Thanks again for having us, and looking forward to all the great things to come.
Sure. Thank you.
Us
Happy
too. Thank
holidays.
you.
Thanks,
Happy
everybody.
holidays.
Bye.